Hi, my name's Hannah and I'm a senior at Memorial High School, and for my capstone, I chose this topic of neonatal nursing. I was looking for somewhere near Eau Claire where they had a newborn intensive care unit population. I went on the Marshfield website and found Dr. Hanna located in Marshfield. She has 14 years' experience working in the newborn intensive care unit. She loves her job, although it does have some challenges. She loves working with her patients every day and helping them get better and being with the families along their journey. She's a very busy nurse, but I was able to set up a phone interview to ask her some questions about daily life being a nurse and the struggles she goes through every day. She loves what she does, but sometimes different patients can be harder than others, creating more stress on the family and herself. My first question asked her what she enjoyed most about being a neonatal nurse. For her personally, she said the families they got to meet and work with long term and how sweet and kind they were, even while being in the NICU. I followed up by asking, what's the longest family in the NICU from her 14 years of working? She's worked there for over 14 years, and the longest baby she's worked with was over a year old when they finally got to go home. The rules back then, the babies stayed in the NICU until they were finally discharged. Now, if they are born at 24 weeks, they are kept in the NICU until they are 50 weeks, because when they are 50 weeks, they are brought to the PICU because that is more child development in the PICU. Next, I asked her what her biggest struggle was with her job. She said it was not her personal struggle, but seeing the families and the children go through what they go through, and them being so anxious because they want to take their child home, although they know this is where they need to be for them to get better. My next question was, do you or the nurses feel that you are being overworked with the extremely long shifts that you guys can sometimes get? She said generally the nurses work 12 to 14-hour shifts 3 days a week, so the nurses enjoy this more than not because the other 4 days they get off, which they enjoy spending time with their family or doing hobbies that they may have. She also said every now and again they have some shifts that work up to 16 hours, which all the nurses in this NICU enjoy because they love being with the babies and helping out their department. She also said for the general nurse and doctor population, most doctors and nurses work up to 12 hours minimum, so it's a very common thing in the medical field. For my third question, I asked how many years of schooling she had to go through after high school to get to be a neonatal nurse. She said she just had to do 4 years because with neonatal nursing, they train right on the job. Once you are hired in the department, they begin orientation, which lasts for 3 months. For the first 6 weeks, they are in level 2, which is learning about the standard feeding, growing, and discharges. This is more the basic standard care that they get in the NICU. Their last 6 weeks is a level 3. Level 3 is when they learn to take care of patients on ventilators, CPAP, and more of the surgical patients in the NICU. This Marshfield hospital I was talking to was a level 3 hospital. There are up to 5 level hospitals where they perform more surgeries and echoes. If that's what they need to do, they transfer them to a hospital that can do that, such as a level 5. For my last question, I asked, what tip would you give someone going into neonatal nursing or the medical field in general? She said when going into the NICU, you have to have a really big passion for babies and working with their families and a love for the job. You get very committed to these families as you see them all the time. If you don't care much for people and you don't like taking care of people, it's probably not the field for you. This field and the medical field in general is a very challenging and not for everyone. So the ones that do their job and take care of us are very special people and deserve more recognition for everything that they do. They save lives and love doing it. That's something we all could appreciate a little bit more. Thanks so much for watching, and I hope you learned more about neonatal nursing.